Dear friends, welcome to our channel. Today, we will be addressing the topic of elevated and low blood pressure. First, let's offer an explanation for those who may not be familiar with it. When we measure your blood pressure, we consider two numbers. For instance, if your blood pressure is 130/80, the top number, 130, represents the systolic pressure, often referred to as heart pressure. The second number, in this case, 80, indicates the diastolic pressure, also known as renal pressure. Therefore, today's discussion will mainly focus on diastolic or renal pressure. It is a common misconception among many individuals that the upper blood pressure numbers hold greater significance compared to the lower ones, specifically the diastolic blood pressure. Consequently, they tend to pay less attention to the lower diastolic pressure. However, this perspective is not entirely accurate. Allow me to shed some light on the roles of each number. Systolic pressure signifies the force exerted by oxygenated blood as it is propelled out of the heart and circulates throughout the body. On the other hand, diastolic pressure represents the pressure exerted by the blood against the walls of the blood vessels. When the heart is at rest between beats, that's when the blood fills the small vessels. As long as the vessels remain healthy and elastic, the lower blood pressure stays within the normal range. However, if, for some reason, the blood vessels become less elastic, constricted, or experience spasms, the lower blood pressure, also known as diastolic pressure, starts to rise. Simply put, this can lead to insufficient blood flow to the brain and other organs and tissues, resulting in decreased oxygen and nutrient supply. As a result, various organs may gradually begin to function improperly. For example, it can lead to deterioration of brain function, decreased clarity of thought, memory loss, a sensation of heaviness in the head, or tinnitus in the ears. Dizziness may also occur, although it is important to note that severe dizziness with a rise in lower blood pressure is rare. Other symptoms that may arise include pain in the back of the head, a pulling sensation, and the feeling of constant squeezing or pressure. Shortness of breath, stabbing or sharp pain in the heart area can also be experienced. However, it's worth mentioning that these are just some of the possible symptoms, as the impact of lower blood pressure can vary from person to person. Some individuals may hardly notice any symptoms, while others may have a harder time tolerating them. Now let's discuss what is considered elevated lower blood pressure and what is not. There is a common belief that everyone should strive for a blood pressure of 120/70, much like an astronaut. However, this ideal may apply more to individuals who are between 20 and 25 years old, not overweight, and lead a highly active lifestyle similar to that of an astronaut. Exceptions do exist, as there are fit, thin young men and women who may have blood pressures as low as 90/60. Conversely, some people may have slightly higher blood pressure, around 130/80, which has been consistent for them since their younger years. It's essential to recognize that even among healthy young individuals, blood pressure can vary depending on individual body characteristics, the nervous system, and lifestyle factors. The important thing to note is that over time, and especially with weight gain, many people experience a gradual rise in blood pressure, and this is considered normal. However, let's discuss the lower diastolic blood pressure levels that we should be concerned about. For example, a reading of 140/90, with 90 being the lower diastolic pressure, is slightly elevated. While it may be higher than ideal, for many individuals, especially those who are older or overweight, it is still within the range of normal blood pressure and not considered critical. Such a blood pressure reading does not require immediate emergency treatment. Exceptions to this include individuals who do not tolerate higher blood pressure levels well, such as those with naturally low blood pressure, like 90/60. For them, even a relatively innocent 140/90 can have a significant negative impact and cause discomfort. However, this is the exception rather than the rule. For most people, blood pressure readings of 130 or 140/90 are generally acceptable. However, if a person consistently has a lower blood pressure of 100 or higher, or if there is very little difference between the upper and lower blood pressure readings, such as 130/110, it is important to take action. A high lower blood pressure reading indicates that blood is facing difficulty pushing through the blood vessels, which can have adverse effects on the brain, heart, and other organs. So, what steps should be taken in such cases, and how should persistently high blood pressure be managed? It is not always necessary to rely on daily blood pressure medication. While medication may be needed in some situations, it is more crucial to identify the underlying cause of the high lower blood pressure and work towards eliminating that cause. By addressing the root cause, there is a good chance that blood pressure will gradually normalize without the need for long-term medication and the associated risks of side effects. Therefore, the focus should be on finding the cause of the elevated lower diastolic blood pressure in order to effectively address the problem. Let's now explore the possible factors that contribute to its rise. Lower diastolic blood pressure can persistently elevate over weeks, months, or even years. It is important to note that there are many simplifications when it comes to identifying the causes of high blood pressure. Some authors attribute all cases to cervical osteochondrosis, while others are certain it is solely due to kidney problems. While it is true that neck issues and kidney problems can contribute to elevated lower blood pressure in some cases, the reality is that there can be numerous different causes. To determine these causes, further research and investigation are necessary. It is crucial to understand that elevated lower blood pressure is not a standalone disease but rather a symptom or reflection of an underlying issue within the body or a result of lifestyle choices. One common cause of elevated lower diastolic pressure is a sedentary lifestyle, where there is a lack of physical movement. To address this, gradually and cautiously increasing physical activity is recommended. Engaging in activities such as leisurely walking for at least an hour a day, skiing, Nordic walking, or swimming can be beneficial. Chronic muscle spasms in the neck area can also contribute to lower blood pressure issues. This constant stiffness in the collar muscles can be alleviated through specific neck exercises. The reduction of muscle spasms in the collar zone has shown to significantly decrease diastolic pressure in approximately 70% of individuals experiencing this problem. Excessive salt intake is another common cause of elevated lower blood pressure. Reducing salt consumption in one's diet for at least 2 weeks can help ascertain its impact on blood pressure. Alcohol abuse is frequently associated with an increase in lower blood pressure. While occasional alcohol consumption, such as 1 glass of wine per week, may not have a significant impact on blood pressure, daily and excessive alcohol intake can lead to substantial increases. It is important to be mindful of alcohol consumption habits. Additionally, smoking over an extended period can negatively affect the elasticity of blood vessel walls, potentially leading to higher lower blood pressure. If you have been a heavy smoker for an extended period, it is worth considering strategies to reduce or quit smoking. In summary, addressing high blood pressure involves a multifaceted approach. It includes increasing physical activity, managing neck muscle spasms, moderating salt intake, limiting alcohol consumption, and addressing smoking habits. Try adopting a plant-based dairy diet for at least a month or 2 and observe how it personally affects your lower diastolic pressure. After this period, you can evaluate whether it is worth continuing with this dietary approach. In addition to the previously mentioned methods, it is also worth considering the role of magnesium in managing high blood pressure. Magnesium deficiency can often contribute to elevated blood pressure, and taking magnesium supplements with vitamin B6 for 3 to 4 weeks may help normalize blood pressure. Repeat this monthly course of magnesium supplementation with vitamin B6 2 to 3 times a year. It is important to note that the methods discussed are not only effective for high blood pressure but also for elevated blood pressure in general. Therefore, they can be considered as part of standard hypertension management. Let's review the steps we have covered so far: adjusting the diet, moderating salt intake, addressing magnesium levels, reducing alcohol consumption, incorporating daily physical activity, and relieving neck muscle spasms. By implementing these measures, it is highly likely that around 80 to 90% of people will experience a significant reduction in their lower blood pressure, bringing it closer to normal levels. However, If for some reason you fall into the 10 to 20% of individuals whose lower blood pressure does not return to normal, it is essential to seek medical attention. Kidney function should be assessed through urinalysis and biochemical blood tests, including parameters such as creatinine, urea, and uric acid. A consultation with a neurologist may also be necessary. Additionally, thyroid function should be evaluated through hormone tests, and any abnormalities should be addressed with an endocrinologist. Adrenal glands may also need to be assessed through tests for cortisol, aldosterone, adrenaline, and norepinephrine. While these efforts may require some diligence, it is important to note that there are situations where medication cannot be avoided. Any blood pressure medication should be taken under the supervision of a doctor, as they need to be tailored to the individual's specific circumstances. Lastly, it is crucial to note that when measuring blood pressure, it should be done in a calm and relaxed state. Rushing or taking measurements during periods of stress can result in higher readings, both for the upper systolic and lower diastolic pressures. To obtain accurate readings, it is recommended to sit quietly for 5 to 10 minutes before taking measurements. Additionally, it is important to refrain from talking during the measurement process, as it can slightly elevate blood pressure. Having a good electronic tonometer at home can facilitate regular blood pressure monitoring in calm conditions. Thank you for your attention, dear friends. We wish you good health and encourage you to subscribe to our channel.